In honor of Black History Month, 21 Alive's Amelia Miles and Tony Benton Jr. have put together a 30-minute special titled Breaking Barriers, A Culture Conversation. Tonight, Amelia is taking us inside that special, discussing healthcare in the Black community.
Now, Dr. Charles Coates owns Anthony Medical Associates. He says the reason he started practicing was because the Black community was not getting the same quality of care, and he wanted to change that. Here's a part of our conversation. So kind of talk about how you got into this business and how it's going so far, basically.
So the interesting thing was I got into medicine because I wanted to be able to take care of my mom. And it seemed like I didn't know any poor doctors, okay? So that's how I got into medicine and give my kids a better life than me. And in my community, I just saw an unequal evolution of medicine. We weren't getting the same quality of care. And it was partially because we weren't getting new doctors into our community. For most of the people, we've had Morgan, Dr. Wilson, who was my doctor, Toles, you know, those legends, they were gone, and there weren't really people in our community doing the same thing. So I wanted to be, if I ever have grandkids, my grandkids, what Dr. Wilson was to me growing up. You know, he was the first person to tell me I could be a doctor, and he was one of the first people to inspire me to want to get out of my neighborhood or expand out of that community. You know, which is weird because once I became a doctor, that was the first place I wanted to go, was to my community. I like what I've been able to do for my family, what I've been able to do for my community. You know, I definitely like where I'm at.
And when you think of Black History Month, and like you said, breaking those barriers and trying to get within those barriers to make sure there's that equal care for people that look just like me and you, how does that make you feel? And what's something that really kind of makes you keep going to work every day?
No matter how bad things are, okay, I come from a family where my mom, and she worked at GTE overnight as an operator, Lincoln Life in the morning, and then she went to IPFW in the evening. My grandfather had 10 kids, and his wife died 2 months after the birth of her last child. So he had to work 2 jobs to take care of his kids. Whatever I have going on in my life doesn't compare to what they went through, so it's easy to continue going. Hard to know that they went through those things, okay, and then I give up on something significantly less. You know, so when I think of Black history, I think of like my mom, I think of my grandfather. I grew up on Weiser Park in Pontiac that, you know, I didn't know I was poor. I didn't know I was missing out on anything. I just knew I loved my neighborhood and I was having a good life. The people that were surrounding me that gave me, you know, inspiration, opportunity, the people that gave me purpose.
When you see the different patients every single day, that kind of sticks out to you when it comes to the Black community, that people are coming in with these problems, that you are trying to fill that void.
A lot of my patients have diseases or have medications, but don't know why they're taking the medication or understand why they have to treat the disease. You know, so the thing that sticks out to me is 9 times out of 10, most patients have no clue or not had anybody with medical expertise explain things to them so that they buy into their treatment. So one of the biggest things for me is making sure that they understand why we're doing it. Yeah. You know, so they can understand the benefits of it.
I feel that 100% because I can see my grandma or my grandpa being very hard-headed about, I'm not taking this, he didn't even explain it, it's probably gonna kill me anyway. So how many conversations have you had like that?
I have conversations like that all the time. And I'm probably, good or bad, notorious for being kind of no nonsense when I give you the rules. And I tell you that if you have a condition that, you know, it's not going to get better, these are going to be the consequences of you not getting better. And even reminding you that I said that when I see you as a follow-up, and then this happens.
And with it being Black History Month and people watching this at home tonight, what's something you really want them to take away, not only from this conversation, but from their health all around?
The thing I would tell you is that you are the manager of your own health. Too many times, at least in our society, we leave it to someone else because we're assuming that they have the same desires as we do, and that's not always the case. Right now in Fort Wayne, our infant death mortality rate for Black and Hispanic babies is the same as it is in third world countries. And a lot of it is because of how care is provided in Fort Wayne. Just because care may not be in your neighborhood, it's and waiting for them to provide it or waiting for them to provide access just means that it's more likely as a pregnant mother that your child's not going to get that care, and you're going to be a statistic that keeps that infant death mortality higher than it should be. It's true that access to medical care on the south side of town is not what it is for other parts of Fort Wayne. Yeah. And it does not appear, given the history of the last 30 years, that the hospitals in our community are trying to improve it. But that does not stop us from trying to improve it. That does not stop us from taking over our own access and the management of our medical care.
Now, Tony and I will also explore Black history in Fort Wayne and so much more. Breaking Barriers, a culture conversation, airing next Wednesday at 7:30 right here on 21 Alive.
Looking very forward to that report. Amelia here with us in studio. Amelia, such a great conversation there with Dr. Coates. What's the one or two things that stood out to you the most?
I think it was the hard-headed thing. When so many people, especially in the Black community and people that just look like us in general, are just very, I guess you could use the word unknowledgeable. And he tries to be that knowledge for them to fill in the gaps. But some people just kind of turn it away, and then he always says they come back like, oh, I should have listened to you because we wouldn't have been in this state. I think that's the one thing that really stood out to me the most.
Now, one of the things about minorities being hard-headed is because there's always been a lack of trust. Historically, there have been times where minorities have been taken advantage of and they've been lied to when it comes to health care. That's why they've been hesitant on this. What does Dr. Coates do to try to build that trust with the minority community?
I think having real-life conversations and bringing in examples, try to be that person that cares, but like you said just there, he sometimes doesn't care at the end of the day, but he truly loves what he does and he will continue to push that knowledge onto those people.
Now, Dr. Coates talked about some of the work he does with the Black community, but I understand he also works with other communities like the Burmese community here in Fort Wayne. Yeah,
in one of those clips, actually, you could see somebody in a hijab, and they are doing translations for some of the patients that come in. He has those type of translators. He has people who speak of Spanish language to make sure that they're trusted and not just saying, here's a piece of paper that's translated in your language, figure it out. He has someone actually there feeling their emotions and seeing them for, who they truly are. It's that connection that is so important. At the beginning of his interview, he talked about the different legendary doctors in the minority community. He mentioned one of them, Dr. Morgan. Yeah. That was actually my doctor when I was a kid. Shows how small the world is. But before you go, Amelia, I also wanted to touch on the bigger special you and Tony are working on. Tell us about that. Yeah, so this Breaking Barriers conversation, me and Tony, we've been friends for a very long time, and he approached me about the special, and I was like, I wanted to do it too, but that's a lot of work. But over these past couple of weeks, we've been talking to beauty salon owners, barbershop owners, healthcare workers, and also taking a dive in just Black history all around. We talked to Bill McGill, and we'll actually be hearing a little bit of that conversation a little bit later in the week. But we just wanted to, give those people those platforms that, yeah, you can go into a doctor's office and hear what they're going to say. Yeah, you can go into a church and hear what Bill McGill has to say. But we wanted to bring it to our 21 Alive viewers out there and show them that this is the things that they should be thinking about during Black History Month. Even though this special airs on, the end of the month, we want this to, stay with them for the rest of the year, rest of their lives. Amelia, thank you. We are looking forward to it. Now, another reminder, Breaking Barriers, a culture conversation. That special is set to air next Wednesday at 7:30 right here on 21 Alive.